You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Sean Wilkie, and along with my awesome co-host, we interview the innovators in this space every week. Super excited about today's guest. I think we've had 6 months worth of scheduling to make it happen. Ivan, why don't you kick us off?
Hi, I'm Ivan Zach, and I'm happy to introduce a veterinarian, a friend of mine, and a colleague, Dr. Aaron Wallace. He's going to talk about digital cytology. So on the business side, Aaron is the co-founder and chief strategy officer of Lacuna Diagnostics, who are, by the way, clients of Veterinary Integration Solutions, veterinary specialty intern in emergency and critical care at Aspen Meadows Veterinary Specialists. He's a co-founder and entrepreneur in residence at eCore, combined MBA and DVM from Colorado State University, Master of Science in Toxicology from Colorado State University, and he holds Bachelor in Environmental Studies and Animal Behavior from Bucknell University. On the personal side of things, we share a similar experience, first experience in veterinary medicine. He was a janitor in a one-doctor practice in high school. The only difference is that I did it after graduating from first vet school in Ukraine and immigrating to Canada. So that's a little different.
You were a doctor while you were
I was well qualified to clean a hospital in Toronto. He was told by two different directors of admissions that he would never be accepted to veterinary school. Well, can I say hello to them? Now, what was their names, Aaron?
I don't think we can go there.
Okay, all right. I just wanted to say hi to them.
Professional.
Aaron is colorblind, and they came up with the name Lacuna as Connor, the co-founder, was tutoring him in cytology. So, Aaron, can you tell us about how did you come up with Lacuna, and welcome to the show.
Hey guys, thanks so much for having me. I really appreciate the show. Yeah, so going through veterinary school, everybody's got their strengths and weaknesses. Maybe the weaknesses were a little heavy on my side, especially with the color inadequacies. But Connor and I were hovered over a microscope, and he was making sure I was going to get through things, and we were actually looking at some cytology and anatomic pathology slides, and the term lacuna came up, which is a gap in a cell, and we kind of just looked at each other and said, "That's it. I mean, we're going to bridge the gap in cytology. This is the name we're going to go with."
That's super cool.
Good.
Yeah. Which kind of I want to ask Sean, how did you come up with Talkative?
Oh, that's a really good question, Ivan. So we hired a branding company, and they presented us with a bunch of different options. And being in speech recognition and having the vertical of veterinary medicine, they were really pushing hard for this name. And I really didn't like it. I didn't like it at all, actually. I was like, no, it's kind of a silly name on play on words between a cockatoo. And they're like, no, it's really good. And then the more I let it sit, the more it stayed. And that's how it came up. I'm not creative at all, and so we hired a professional.
Confirm. And Aaron, your story is much better.
Such a dickhead move.
So how did you get into cytology? Basically, this is a field that I would always think that there's, that the bigger companies in diagnostics are competing in that area. You took a very small niche and you excelled in it, and you have multiple customers right now using your product. So how did you guys come up with the idea?
That's an interesting thought. I mean, really, it came down to, we were in business school. So Connor and I were going through veterinary school during the day and business school at night, and wanted to start a business. So we were out looking for a problem to solve. And I was actually at my wife's Christmas party when Connor sent me a text. He was actually working inside of the diagnostic lab at our university, and samples were showing up frozen, and the glass was broken. The microscope slides were broken in half. There was no paperwork with some of the slides, and we have no idea where it was going. And, he texted me and said, "What is the value of digitizing the microscope slide at the hospital, just like we digitized the x-ray?" And I immediately was, blown away by Connor's idea, and walked across the Christmas party to a clinical pathologist and, per Connor's instructions, said, "Hey, what's the value of this?" And from there, it's been a rocket ship. We've just been, being in the front of the technology, being at the front of, leading this in the industry and just trying to do it the right way. And cytology for me, the colorblind guy, that's not really where I focus my time, but being in the point of care solution to bring this diagnostic modality to the veterinary hospital is something we're very passionate about.
It's awesome, Aaron. So, I mean, we've known each other now for a couple of years. Man, where does the friggin' time go? And I remember, just as you guys were getting kicked off a couple of years ago now, the way that you guys have positioned and built your product offering is really unique. So I know we have a ton of veterinarians that listen to the podcast. So if a veterinarian was to call Lacuna and say, hey, I'd like to get started with you, this is really interesting, what does that experience look like from start to using your service? Talk to us about the hardware, talk to us end to end, describe it to our listeners, please.
Yeah, no problem. So, we started Lacuna before the technology really existed to be able to do what we're doing today. So, at the time when we started Lacuna, in order to digitize a whole slide, meaning get all the cells on a slide, the cost of that technology in human medicine was so high, it could never come to even the largest veterinary hospitals in our country. So we started with a lesser technology to figure out our platform and figure out how to actually interact with veterinarians kind of as a minimal viable product. Now we accelerate that to today. When someone calls us on the phone, we have the ability to upload questions on cells from just taking a picture through your microscope, with your cell phone and uploading the cell that you're concerned about, the whole way to providing free equipment to hospitals that can scan the entire slide and upload multiple slides from, one site, Cytology, up to our pathologist through our Lacuna portal, where we get results back, faster than anybody in the world.
I think your guys' offering is really unique in like how you put the hardware in the clinic, and it's an all-in-one thing. So I think it might make sense to go a little bit more in depth with that.
Whenever we install hardware in a hospital, we're a full solution. So we provide the equipment, we provide the customer support, we provide the portal, we provide the training. So whether you're, if you're across the globe, we can do virtual training. If you want us to come do in-person training, we can do that as well. But the reality is that we ship the entire unit to you and allow everything you need to upload digital images of microscope slides for your hospital instantaneously.
That's excellent. So I'm going to ask a little bit back in the vet school. I know that there's I know only 2 vet schools that offer this, but I think that being a veterinarian, I can actually say this. I say this a lot, that veterinarians are terrible business people because we learn how to treat animals, not how to run the business. And then a lot of veterinarians convert into running their hospitals without having any background. So 2 vet schools that I know, Texas A&M and Colorado, have MBA incorporated, which is, I think, brilliant idea. Can you tell us about that experience and what did you think about the workload that you had to do in vet school and what it would be like without?
Yeah, so we can walk down memory lane. That sounds great. So when I applied to the combined MBA DVM program at CSU, the opening sentence of my application was, I was really focused on trying to understand the business models of veterinary medicine to be able to provide a higher standard of care with a strong business model. I think we all learned in 2008 that those things are more co-aligned than we ever knew. Even especially with what we're dealing with in today's economy, that's really taken home, and that point is even more solid than ever. But going back to the workload, we would go to veterinary school, from 8 to 5, and then walk across campus, and then go to business school from 5:30 to 9 p.m. And one of the things that I think is one of the takeaways of that experience, being a few years out of that, is I think we take for granted how our clinical reasoning skills and lean startup methodology are pretty much the same. Right? I mean, and Ivan, you can speak to this, but you take your build, measure, learn of lean startup methodology, and then you look at the way that we assess our patients through a physical exam. We combine problem lists. We take those problem lists, we group them together. We do diagnostics to learn more information. Then we circle back and eliminate potential differential diagnosis. So it was really an interesting experience to go from the veterinary classroom to the business classroom. Really, you're learning the same thing, just using a different language.
Yeah, it's totally makes sense. Not that I could speak on that, but Ivan will agree with you. He was shaking his head. So, but one of the things that I can't help but ask, Aaron, is how you guys have leveraged the technology that you've built to optimize the process. And obviously, being able to turn something digital and not send it in the mail makes a ton of sense. But what's it like to interact with your technology, and how have you used technology to innovate and really drive adoption of your tool? Yeah, and why is it so much better than the old way?
Yeah, no, that's good. I think one of the I guess, fortunate avenues that Lacuna took was not just focusing on the technology. I think we get focused on the technology and we get focused on what's cool and flashy and shiny whenever we're innovating. But Lacuna has always zoomed out and thought about this entire process from the beginning. I mean, bells and whistles, shiny technology is a part of what we do, but there's a lot more of what we do too. We're talking about diagnosing pets with disease. I mean, this is not something that we can just throw around and be almost right on. We need to be correct. And so what we've done is we've kept kind of the trifecta of making sure we have the most expert pathologists in the world. We have more pathologists that have read digital slides than any other organization or any other company in the world. So having that expertise focused on being the most definitive diagnosis we possibly can, which allows our pathologists, which is basically made possible by our pathologists being able to collaborate on cases. So having the ability for a digital slide to be sent out to multiple pathologists and being able to be read in collaboration to get the best answer back to the hospital is another factor of that. And then also keeping an eye on the prize. We're trying to bring this digital technology to as many veterinary hospitals as we can, not just from the business point of view, because this is an incremental move in standard of care. I mean, if we look back to when radiology went digital, that has changed the way we practice medicine. There just a couple weeks ago, I missed a fracture as a clinician. The radiologist caught it. If that would have been 20 years ago, that dog would have went home with a fracture. And the same thing happens in cytology. So, keeping it on just, those bullet points is, yes, the technology and interacting with the technology is important, making sure that our platform is the best user interface and best experience and ease of use that we possibly can have for the veterinary technicians using it, but also making sure that we have board certified clinical pathologists with the expertise needed to be able to collaborate together, kind of brings this whole thing together. So it's not just about the technology, it's the whole piece.
That's awesome. And I don't know, Aaron, if I mentioned to you, but in 2007, right after the vet school in Canada, I went back to Russia and they started a diagnostic lab there. And it was the first full service diagnostic lab, and the difference was with the existing lab in Moscow that was sort of just starting at that point was the cytology and pathology that we were doing the slide. We were processing the raw materials and slicing them in Russia, and then working together with Atlantic Vet College, interpreting them there. It was a different purpose. It was a different geographic, but we were actually doing the similar thing. We were scanning the images. So that's it's incredible to see how you took it at scale. And but the one thing that I know about you guys is that it's not just about technology. It's not just about processing so many samples. You've built a special relationship between you and pathologists and your clients and pathologists. So there's more sense of community. When you're going to telemedicine, it became so just a list of things to do, where I think that pathologists just all over the world grab the next case, process it, and there's no attachment. I think that you guys are really creating a tribe and people are committed to your brand. This is not something that you can easily do with just scale. This is something that you hold, and if you can scale with this, then I think that's a true success. So can you tell us a little more about the relationship and how you establish communications between the clients and pathologists?
The culture at Lacuna basically revolves around the veterinary hospital. We want to bring a virtual clinical pathologist into the chair sitting next to the specialist. They're able to be accessed by phone, they're able to be accessed by email, they're actually able to be selected. So, for instance, dog comes into the hospital and, maybe you find a lymph node that you aspirate and you send that off to a pathologist, and the pathologist maybe diagnoses a disease and says, hey, to stage this, you should do an ultrasound. And if there's anything there, we should, take a look at those samples as well. In traditional clinical laboratories, it's very difficult to get that sample right back to the same pathologist. With the Lacuna portal, the Lacuna system, and the culture we've built around this interpretation of a digital microscope slide, that appointment could be at 8 a.m. where we take that aspirate of that lymph node. That ultrasound could happen at 2:30 p.m. or maybe the next day. And that sample can be sent right back to the same pathologist. If there's a question about that case, they can be accessed. We can collaborate together all through the Lacuna portal.
Yeah, that's really interesting. And so I wanted to kind of interject because I've had experience with your team as well. A couple of them are on our platform using our voice recognition software. I've known you for a couple of years, and then all of a sudden, I think you sent me off to one of your partners, like it was Connor. I was chatting with him, and all of a sudden, I'm on the phone with somebody in New Zealand, and they're one of the pathologists that works within your organization. So, talk to us a little bit about the team. It sounds like it's a really important element of your organization, and just the type of quality of the people that you work with to bring these services to your clients.
Yeah, I mean, I think the Lacuna team is important, but more importantly, it's our pathology team, like you're referencing. So, Lacuna really wants to bring the best expertise we possibly can to our clients, and that's a part of our brand. So we have a combination of full-time clinical pathologists, Jen, Julie, and Sabrina, in 3 different time zones across the world. We also have approximately 20 contract pathologists reading for us at all different times from, I think, 6 additional time zones across the world. So, the reality of this is it's not about time zone. It's not about just credentials. It's a matter of everybody's board certified and everybody goes through a quality control process to make sure that they fit our brand. So you want to just come read digital, you don't just sign a paper and start getting paid. You come into our quality control team where our senior pathologists send you digital cases, they're critiqued, and we've really built a culture around this is the way we read digital and this is the way we get to a definitive diagnosis, and we comment appropriately, and everybody fits that.
So that's probably the question that some people have, and I heard this also about the radiology, and now the whole hype about the VCPR and that kind of stuff. So just to make it clear to those that are using your service, if you have pathologists in different geographic zones and they're different jurisdiction from where the veterinarian who is requesting the service is residing, that is not telemedicine. From my understanding, that is telehealth. So can you tell us about the regulations around that so we can sort of give more information to potential customers for you?
Yeah, no. So I think that's a great analogy. So anywhere that digital radiology is accepted, digital cytology is accepted as well. So the difference really is that, Ivan, when you and I are in practice and we send out a radiology report, or we send out a radiology image, or we send out a cytology image, that specialist on the other end is actually interpreting just that. It's our responsibility as clinicians to take their interpretation and apply that to our patient, in which our patient that's standing in front of us, we have a contract with. We follow the rules, right? So the regulations around us being able to get that outside consultation on a diagnostics is widely accepted around the world. Everywhere that there's digital radiology, digital cytology falls right in line.
Makes a ton of sense. Yeah. So the next question for me is, where do you go next? You've got a bunch of data that you're collecting. I think who owns the data is the question that always comes up in my mind. And, this data could be used for things like AI. What direction does your company go in next, and at what rate are you guys growing right now?
Yeah. I mean, again, still focused on the veterinary side, but you're right. I mean, there's more to this than just the diagnostics. And in the background, we are working not just on artificial intelligence, but, people way smarter than me are organizing our data in a way that, big data sounds like this awesome and cool thing, but the reality of it is it doesn't mean anything unless it's organized appropriately and can be extracted appropriately. And Lacuna's working on that a lot. We are focused on not replacing the pathologist. And I want to say that out loud. We are focused on being able to provide artificial intelligence assist for our pathologists to make them more speedy, be able to see more cases and do more definitive diagnostics, more definitive interpretations of slides. We're looking for ways to, how can we take artificial intelligence and big data and get to a further point? I mean, is there a possibility where we're unable to grade a certain type of tumor on cytology today, but combined with artificial intelligence and big data, maybe we can get to more than just, this is lymphoma. Maybe we can understand more about that. So it's really exciting time. Our growth we're very blessed, and we feel fortunate that we're adopting clients the way that we are, because, whenever we I was just looking at the first 75 cases that came through yesterday, just to kind of give us an idea. And I start saying things like that out loud, like the first 75. I mean, you're talking about 18 months ago, we had 75 and a quarter. So, whenever we're talking about the first 75 cases and averaging about an 80-minute turnaround time, the fastest yesterday was 9 minutes. We had specialists and hospitals on 3 different continents working on digital cytology yesterday. So it's a really exciting time for Lacuna, and I gotta I got to throw the props out there to the cool Connor and Garrett, the other co-founders. They've done an excellent job of growing the business.
Way to go, guys. I mean, I do want to know names of those two different directors that told you that you're not going to be accepted to vet school. But you did prove,
dig.
you did, you said that my color blindness wouldn't help me in this business. I think you did even better. You supplemented your color blindness with the entire business for the world to bring this technology. Just like Sean, he can't spell anything if his life depended on this, so that's why he's developing voice recognition. Way to go.
Our friendship is doomed. So I wanted to just compliment Aaron and probably insult you, Ivan. So just give me a minute while I'm complimenting Aaron. I'll come up with an insult for you. So Aaron, I got to say, I remember a couple of years ago, we're in San Francisco. We're at Investor Summit. You're there. You're in school. You're doing an MBA at the same time as you're doing vet school. And you're starting a company all at the same time. Either you're crazy or you're an overachiever or a combination of the both. But I just want to let you know that as a fellow entrepreneur, I saw all of those things happening. And I think what you guys have pulled together and how quickly you've got from 75 and a quarter to 75 in the first part of the morning on the day is quite absolutely incredible. So at a go. And I guess as a friend and a fellow entrepreneur, I would definitely say anybody that's got the slight bit of interest in what you guys do should absolutely follow up. So how do they do that? How do people get a hold of you guys? What's the easiest way?
First of all, thanks for the compliment. Can't take that. I'm the one here, but there's a whole team of guys, out there helping this happen. That's really how this got done is not just by me, but by, having a great team and being very fortunate to surround ourselves with great people, which I think is something that you guys do very well. Also, getting a hold of Lacuna, there's several ways. You can come to our website and schedule a demo right there. Click on the link, lacunadiagnostics.com, and we can get you a demo set up, or you can shoot us an email right there from the website. And we'll be happy to contact you. We can give you use cases. We can talk to you about your cytology load. I'd be more than happy to give you some personal experiences of ways that I've used digital cytology outside of being a founder, actually being a customer of my own company. It's very interesting to see the dog that's seen 3 veterinarians and they can't figure out what's going on and go in and say, hey, look, let's aspirate this lymph node. I'll give you an answer here in a couple hours. We'll know what's going on. This might be it. And then go back to them and say, hey, guys, we got a plan. So be happy to share those experiences and talk with anybody. It doesn't matter if you're a veterinarian, doesn't matter who you are. We're happy to talk about digital cytology to anybody.
Total awesome. Digital cytology nerds, right?
Yeah. Well, minus the cytology part.
Yeah. Well, before Sean came up with an insult for me, we'll round it up. So we have 2 questions for the guests usually. One of them is there a TED Talk, a book, or anything on YouTube that you recently saw, read, or heard about that you would like to share with the listeners?
I guess there's been 2 books in the past year that have kind of, one I've revisited and one I've just finished that have been influential. First, anybody who is in a startup or in a business, I highly recommend reading Deep Work by Cal Newport. It's kind of changed the way I've structured my day. It's changed the way I've thought about different projects and being able to work effectively and dive deep on and getting more effective results. And then, seems like every 2 years I go back now and read The Founder's Dilemma by Wasserman. I think that anybody who's in a startup and building a team, or anybody who's thinking about taking the leap to being a full-time entrepreneur, it's good to take a look at that book and look at some of the experiences that they share in there.
And before he gets a chance to insult me again, how about another innovator we should have on the show? Aaron, you got anybody in mind?
Yeah, I put some thought into this because I see this question asked on the show. I guess I'll throw 2 out there. One who's a legend, and one that I think you guys should take a look at. So first, friend of Lacuna, Fred DeSchol from Mix Labs, doing some pretty innovative things for personalized medications and compounding pharmacies. So I think he'd be an interesting guy to talk to. And then I see Adam Little hasn't made an appearance yet on the podcast, and as a friend, but also as someone that a lot of us can thank the innovation movement in veterinary medicine too. I think he would be an excellent one as well.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinarynnovationpodcast.com. See you next week.